All right, guys, how are you? Can you guys hear me okay? Can you hear me okay? Can you hear me okay? Can you hear me okay? All right, let's rock. You guys got your you were able to get the All right, let's rock. Uh-oh, let me just turn this around. So you were able to get your worksheets, I hope. I'm looking at you on the screen from my phone. So you guys got the worksheets, okay? So we're gonna just go ahead and finish this series out. It seems like it's been forever. I'm off orientation now. I'm so happy. So no more disruptions. All right. So let's rock, okay? Let's go. All right. So health promotion and maintenance, part 3. So I included a couple of little questionnaires for you guys. So why do I put this here? This is the NCSBN test plan. So it kind of gives you it does. It definitely gives you insight on what's going to be on the NCSBN test plan and what's going to be on the NCLEX. So you want to just make sure that you master these areas and always score yourself. Notice here I put I want you guys to really think about it, brainstorm. How much do I really know? And then score yourself. Do you feel like you're a 90%? Do you feel like you're 80% in these areas? Like, be honest with yourself, because those are the areas that you want to work on. All right. So I put for every topic in NCSBN on the NCSBN blueprint, I put a little score, a little percentage here so you can go through and kind of just judge yourself. All right. All right. So let's get started. All right. So the first topic, we're going to go through 200 topics together. And then we'll go over 200 topics tomorrow. And that should do it. That should give you a good chance, so you'll really understand a portion of the health promotion and maintenance. We've gone over, that would make at least 600 topics. So that should help you a lot. All right. So cognitive development. All right. Cognitive development. So we're here, and I know you guys can see my screen watching myself. Cognitive development. Let's talk about Piaget. Okay, Piaget. Sensory motor is the blank. Excuse me. Sensory motor. Sensory motor stage transitions to the pre-operational stage around 2 years of age. So now we are dealing with the toddler between the ages of 1 to 3. So according to Piaget, sensory motor stage transitions to the pre-operational stage around 2 years of age. So number 1 is sensory motor. All right. The concept of object permanence. Remember, object permanence becomes fully developed. Now, this is huge. All right, so object permanence is huge for us as nurses or as first year nurses. We have to understand that after around this age, object permanence becomes fully developed. So that means if you put a toy under a pillow, the child knows, the toddler knows that the toy is still there. And that's very important, okay? All right. 3 is toddlers. 3 is toddlers have and demonstrate memories of events that relate to them. So these toddlers can demonstrate memories of events that relate to them. They have a memory, they have recall now. Domestic mimicry. So when you mimic something, like playhouse is evident. Now the toddler 1 to 3, they want to play house. All right. Playhouse is evident. 5. This is huge, and I want you to put this in red. Pre-operational thought does not allow for toddlers to understand other viewpoints, but it does allow them to symbolize objects and people to imitate previously seen activities. So they don't understand others' viewpoints, you know? But it does allow, this pre-operational stage does allow them to symbolize objects and people to imitate previously seen activities. So this is when you'll see the 3-year-old in her mother's high heels, or a 3-year-old that has his father's tool belt. All right. So language development is the blank space. Let's talk about language development for a 1 to 3-year-old. Language increases to between 50 to 300 words. So 50 to 300 words. And that's important, believe it or not. 50 to 300 words by the age of 2 years old. 1 year using 1-word sentences. So 1 word. And 2 years multi. 2 years multi-word sentences. So they're combining 2 to 3 words. And then 3 years combining several words to create simple sentences using grammatical rules. So language development. All right, so you have to remember that 50 to 300. Now, how are you going to remember that? 1 to 3, 300 words. The age is 1 to 3, 300 words. That's a little quick fact for you. 300 words. So psychosocial development and psychosocial. Psychosocial is Erikson's. So embrace Erikson's. If you can look at a video on Erikson's, just fall asleep to it. Embrace Erikson's before you go to the board. So Erikson's autonomy versus shame and doubt. So shame and doubt. So this is the time that you want to encourage the toddler to do things like, oh, you're doing a great job, because they are becoming, they want to do, they're more self-sufficient. And if they are talked down upon or criticized, overly criticized, they'll have that shame and doubt that will stick with them throughout. I have a video that breaks this down very well on this channel, on the YouTube channel. So Erikson's autonomy versus shame and doubt. Independence is paramount for toddlers. It's very important for toddlers. All right. It's very important around this time. It's paramount. 12. Toddlers often use negativism or negative responses to express their independence. So we call it like the terrible twos, because they say no to everything. Negativism. Toddlers often use negativism, or they'll have negative responses. That's how they exert themselves. That's how they become independent. And 13 is ritualism, or maintaining routines, maintaining the same routines. Reliability, it means a lot to them. All right, so routines, maintaining routines. Reliability provides a sense of comfort for toddlers as they begin to explore the environment. So remember that routine, even in the hospital, in this perfect NCLEX hospital, we keep a steady routine. All right, and remember that for that toddler in the hospital, we have that routine going. Moral development. Moral development. I want you guys to write Kohlberg's. Remember Kohlberg's? Moral development. So 14 is moral development. Moral development is closely associated with cognitive development. Egocentric toddlers. Remember before we wrote that they cannot understand someone else's perspective. They're egocentric. It's all about them. Me. So 15, egocentric toddlers are unable to see things from others' perspective. It is all about the toddler, guys. Okay? (16) Punishment and obedience orientation begin with a sense that good behavior is rewarded and bad behavior is punished. So 16, this is how the moral development is established, right? I'm being good, I get a reward. If I'm bad, I'm going to get punished. So just imagine people or adults that have never had correction. All right. So 16. So remember that. Miss McGriff, are you okay now? Are you able to get on? Are you able to follow along? All right, and here is moral development. Moral development. Okay, moral development. Oh, no, I'm sorry. Now we're into age-appropriate activities. This is huge. I'm going to give you a hint. This is, go ahead and write NCLEX. Age, oh, you're welcome. Age-appropriate activities. Now, this is important, especially if you're working in the hospital pediatric unit. What are some age-appropriate activities? So, solitary play evolves into parallel play. Now, that solitary play is now parallel play. They look at other children, they look at other toddlers, and they might engage in activities nearby. So that parallel play, not I'm not playing with you, I'm next to you, you're doing your thing, I'm doing my thing. So what are some age appropriate activities? And I want you guys to go ahead and write NCLEX here. This is where they're going to get you. So NCLEX, very important, age appropriate activities. So filling and emptying containers. A is containers. Filling and emptying containers. Playing with blocks. Looking at books. And you see, look at the term, looking at books for C. Looking at books. Push, pull toys. Push, pull toys. Tossing balls. Finger paints. Large piece puzzles. So G is large piece puzzles. And H is thick crayons. Thick crayons. So these are your age appropriate activities, and this is normally what they'll ask you on the NCLEX. All right. Temper tantrums results when toddlers are frustrated with restrictions on their independence. They don't want you to tell them what to do anymore. So temper tantrums, the terrible twos. Providing consistent age appropriate expectations. Age appropriate. So age appropriate expectation, that is huge. Helps toddler to work through frustration. You have to know what you're dealing with, guys. So providing consistent age appropriate expectations. All right. If a child is between the ages of 1 and 3, what can you expect from that child? 21. Now, this is a biggie. I want you guys to write 21. Put it NCLEX. Toilet training. Toilet training can begin when toddlers have the sensation of needing to urinate or defecate. Toilet training. Parents should demonstrate patience and consistency. Patience and consistency and toilet training, and it's consistency and patience, guys. 24, nightmares control might develop nighttime control. So expect some bedwetting. And 24 is discipline should be consistent with well-defined boundaries. All right, so discipline has to be consistent. There has to be boundaries. You want to develop appropriate social behaviors, but remember, between the ages of 1 to 3, what can you expect? So why is it important for nurses to understand this? Because if you're dealing with the pediatric population, You have to know about the age appropriate activities. You have to know about moral development, rewards, and punishment. Because remember, they love those stickers. This is a child that you can give a sticker. You can give them a sticker if they're behaving, if they get through a procedure. They love that. That's what they know. And also, if the child tells you no, you're not going to just, you know, completely reject the child. You'll understand that they are exerting their independence. And if I set clear boundaries, if I have defined boundaries, then we'll probably have a better shift. So I want you guys to write that. Defined boundaries. So this is huge when it comes to therapeutic communication. So that well-defined boundaries begins between the ages of 1 and 3. And I want you guys to put that's NCLEX. That's an NCLEX question. That's one of those critical thinking questions that you will get. You can start, you must, between the ages of 1 and 3, you start to develop boundaries. Because they're independent and you're independent. So how is this going to work? Okay, the doozy here. Our favorite, vaccinations. Our favorite thing in the world to talk about. So what I would recommend doing is, find the timestamp. The timestamp is, I'll break down the times, but listen to it over and over and over and over again. If I find a lecture of someone who breaks it down a little better, I'll share it with you guys. But immunizations, it is what it is. It's just memorization. All right. So the Center for Disease Control and Prevention. So Center for Disease Control and Prevention. They run the show. So for immunizations, just go to CDC and download the immunizations. What I did, I'll show you guys. I'll send you an example of what I did. Okay, so I can memorize, or I can kind of get through these questions. I'll send you an example of what to do and what I did to memorize these vaccinations. All right, so 25 is the Centers for Disease Control. They have their recommendations they want us to follow. So from 12 to 15 months, A is inactivated poliovirus. Inactivated poliovirus. And then that third dose is going to be between 6 to 18 months. B is Haemophilus influenza type B. Haemophilus influenza type B. C. Uh-oh. I have a little misprint, but that's okay. We'll work with it. Scratch out that 27. This is C. C is pneumococcal conjugated vaccine. So pneumococcal conjugated vaccine. Pneumococcal conjugated vaccine. Now we're here. Measles. Mumps. And rubella. Measles, mumps, and rubella. So when it comes to when this child is within childbearing age, right? So we know that this child has this rubella vaccine, because that's a huge issue during pregnancy. So measles, mumps, and rubella, varicella is huge. Later on, for now and later on down the line. So let's recap. So the immunization from 12 to 15 months, inactivated poliovirus, Haemophilus influenza type B, pneumococcal conjugated vaccine, measles, mumps, and rubella, varicella. Now, let's squeeze it in here, guys, where it says 12 to 13, 12 to 23 months, 12 to 23 months. That's your Hep A. Hep A, 12 to 23 months. So that's 1 year to 2 years. They have that little, they have time. 12 to 23 months, that hepatitis A. And it's given in 2 doses. And they have to be given at least 6 months apart. 6 months apart. So Hep A, that's a very important vaccination, especially because, guys, we eat out a lot, and some, you just have to be very careful about contracting some of these different hepatitis viruses, right? So this really does protect us, and it starts at a very young age, because this is 1 to 2 years old. They're giving the Hep A. As long they want it that year, as long as it's 6 months apart. So between 1 year and 2 year, 6 months apart. So there's ample enough time, to get it done. All right, 15 to 18 months. That's the diphtheria, tetanus, and pertussis. So diphtheria, tetanus, and pertussis. Diphtheria, tetanus, and pertussis. They call it DTaP. You can put it DTaP. And 12 to 36 months is the yearly seasonal trivalent inactivated influenza vaccine. All right. And I want you to underline live attenuated influenza vaccine. And that's the child must be 2 years old, because it's live. All right. Live attenuated influenza vaccine. So if your patients are immunocompromised, they're not supposed to have a live attenuated vaccine. So this is one of them. Live attenuated. So I want you guys to really embrace that word, live attenuated vaccinations. So this toddler can have it. They can have it by nasal spray if they're 2 years old, because then they can handle it. All right, guys, a huge deal. This is nutrition. This is your basic care and comfort. Nutrition. All right. So we're nurses, and we obsess over patients' nutrition. So even on the floor, you always ask, what's the patient's diet? All right. So imagine you have this 1 to 3 year old toddler. You need to know about the nutritional needs for this child. All right. So children might establish lifetime eating habits during this time. This is lifetime. All right. Lifetime eating habits are going to develop now between the ages of 1 and 3. That's deep. So 31, toddlers begin developing taste preferences and are generally what? Picky eaters. So anticipate that happening. 1 to 3, picky eaters. And physiological anorexia occurs. Anorexia. Because they are picky eaters. Physiologic anorexia. The doctor will say they'll get what they need. Physiological anorexia, because they are picky eaters. You as a nurse, and this is you, toddlers should consume 24 to 28 ounces of milk daily. 24 to 28 ounces of milk, okay, per day. And they can go to low fat after 2 years, but they need their milk. Juice consumption should be limited to 4 to 6. Look at that. That's 1/4 of milk, right? 1/4 of milk consumption. So milk is the big thing for a toddler. Trans fatty acids and saturated fats should be avoided. So trans fatty acids, saturated fats, avoid them. Because remember, 1 to 3 is when those habits form. Diet should include 1 cup of fruit daily. So 1 cup of fruit daily. And underline that fruit, because not every fruit, because we don't want the toddler to choke. Food serving sizes should be 1 tablespoon for each year of age. So here we go. This is you. This is your NCLEX, okay? Food serving size should be 1 tablespoon for each year of age, or 1/4 to 1/3 of an adult portion. So remember, we're trying to develop healthy eating habits. So food serving size, 1 tablespoon for each year of age. Or it should be 1/4 an adult or 1/3 an adult, a food portion. So they shouldn't have an adult sized portion of food. Toddlers generally prefer finger foods, right? Because they want to feed themselves. But this causes an issue for us. This can cause aspiration. Finger foods and aspiration, huge deal. Toddlers want to be independent. They want to feed themselves. They want the finger foods. But we have to make sure that we're giving them the correct finger foods. Regular meal times and nutritious snacks. So nutritious snacks for these guys. Snacks or desserts that are high in sugar or fat or sodium, avoid them. Avoid high in sugar, high in fat, high in sodium. So if you're a part of the WIC program, you notice that you can only get certain juices, there's only certain things that you're allowed to purchase under the WIC program, because they want to ensure that, they want to put a cap on the sugar, the fat, and the sodium, because we're developing healthy habits now. Now, underline 41. 41 is your NCLEX. We specialize in safety. Safety is number 1. Safety first. So, foods that are choking hazards. That can be a choking hazard. All right? I want you guys to write it, even though it's there. I want you to write it because this is your NCLEX. A is nuts. Nuts can be a choking hazard. Grapes can be a choking hazard. Hot dogs can be a choking hazard. Peanut butter is a choking hazard. Raw carrots is a choking hazard. Dried beans is a choking hazard. Tough meats like steak, sometimes even chicken, tough meats can be a choking hazard. And popcorn can be a choking hazard. So these are foods that are choking hazards. So this is your NCLEX. So you don't want to give a toddler any of these. So if you get a select all that apply, remember popcorn is there. Popcorn is there. Nuts is a choking hazard. Peanut butter is a choking hazard. So there's your NCLEX quick fact. That's your tip right there. Adult supervision should always be provided during snack and meal times. So during snack and meal times, you should be monitoring the child. Snack and meal times, you have to stay there with the child because of aspiration. They're at an increased risk for aspiration. They're at an increased risk for choking. And food should be cut into small bite-sized pieces to make them easier to swallow, because we don't want any choking to occur. So cut them up in small pieces. So if you're on the floor, cut them up small pieces. Of course, dietary knows about safety, but as a nurse, you can just reinforce. "45, toddlers should not be allowed to engage in drinking or eating during play activities or when laying down." So no drinking or eating. No drinking or eating when they're laying down. No drinking or eating when they're playing. Parents should follow the U.S. Department of Agriculture's guidelines. So no drinking, no eating if the child is laying down. No drinking, no eating. And that is that for nutrition. Let's talk about sleep and rest. Sleep and rest now, which is huge. I want you guys to make sure that you know the complete sleep cycle. You have to know the sleep cycle. That's an NCLEX question. That's another hint for you guys, another little tip. All right, you have to know the sleep cycle. It is on the NCLEX. So sleep and rest. Typically, toddlers typically average 11 to 12 hours of sleep a day. 11 to 12. All right, 11 to 12 hours of sleep per day, including one nap. So that's normal. Naps are often eliminated in older childhood. And of course, the resistance to bedtime and expression of fears are common between the ages of 1 and 3. This child does not want to go to sleep. They will resist bedtime. And they should have 11 to 12 hours of sleep to be able to function the next day because they're still growing. Maintaining a regular bedtime and bedtime routines are helpful to promote sleep. So again, 49 is promote sleep. The routine is the key here. Bedtime routines, even if the child is hospitalized, bedtime routines to promote sleep. All right, let's talk about dental health. Dental health. All right, I haven't heard too much about dental health, only the fluoride. All right, so children should have an established dental provider by the age of 1. They should be going to the dentist. 51 is flossing and brushing. Flossing and brushing should be performed by the adult caregiver. That's how you remove the plaque. Flossing and brushing. Flossing and brushing. And the adult should be doing it. 52, brushing should occur after meals. They should occur after meals and at bedtime. after meals. And this is huge. Okay, if you're taking the exit, this is it. This is for you. Nothing to eat or drink except water is given to the child after the bedtime cleaning. Water. That's it. You can give water after bedtime. And fluoride is something that is put in on the water in certain areas. So fluoride is a supplement. I got my fluoride yesterday. All right. Fluoride is supplemented for children living in areas without adequate levels in the drinking water. Early childhood caries. So caries is just cavities. Early childhood cavities is a form of tooth decay that develops in toddlers and is more common in children who are put to bed with a bottle of juice or milk. So juice, 55 is juice or milk. Now, to avoid those cavities, no juice or milk. Don't put the child to bed with juice or milk. Consumption of cariogenic foods. Cariogenic foods. So, should be eliminated if possible. So, what does cariogenic mean? Since I have to avoid them. These are foods that cause tooth decay. All right. These are foods that cause tooth decay. It's those sweet snacks, things that stay on the teeth and things that cause plaque and tartar. So just try to avoid them at this young age. And remember, you are also establishing better, eating habits. And if not, the frequency of consumption should be limited. So those, snacks, those sweet snacks and candy, you may want to just try to keep it at a minimum. All right, 58. Now this is you guys. Look how many for 58. Look at 58. So from 58 to 90, that's injury prevention. So this is huge. I want you guys to write safety and infection control here. Safety and infection control. So you're killing two birds with one stone. Injury prevention is health promotion and maintenance, and safety and infection control. All right. So you're knocking out two subjects now, and it's the meat. It is very important for us, for nurses. Safety, 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 teaching, safety, safety, safety. And for every age group, there's a different teaching. There's different education. There's a different pamphlet. All right, so here we go. 58 is aspiration of foreign objects. That's number one. Aspiration of foreign objects. That's what we're trying to prevent. 59, small objects like grapes, coins, beads, candy that become lodged in the throat should be avoided. So anything that is small enough to become lodged into the toddler's throat, you want to keep it away from the toddler. So no coins laying around, no colored beads laying around, no candy laying around, no grapes laying around. Make sure you educate the family. And if the patient is in the hospital and they have these things, you have to let the family know. 60, toys that have small parts. Toys that have small parts, you want to keep them out of reach. 61, clothing should be checked for buttons. Oh, I'm sorry. 61 is age appropriate. Sorry. Age appropriate toys. Age appropriate toys is 61. And then 62 is clothing. So clothing should be checked for safety hazards. Sometimes you'll hear about clothing recalls. All right. Clothing should be checked for safety hazards. Like they have those loose buttons and that can become lodged in the throat. 63, balloons should be kept away from toddlers. Balloons. Because once they pop, they become safety hazards. So balloons. And parents should know emergency procedures for choking. So they should know the Heimlich maneuver. Now, this is for you guys. Make sure that you look at a video. It is on the board. There is a picture where they want you to perform the Heimlich maneuver on, well, you can't even perform the Heimlich maneuver. There's a toddler that is choking, and you have to point out the correct procedure to help a choking toddler. All right, so just remember that. Put NCLEX next to that. All right, there is a picture. So remember, back blows and chest thrusts. Remember that. And I'll send you guys a video also because that is on the board. All right, I should have put a picture there. Guys, make sure I'll send you the video. You have to know how to help a choking child, a choking toddler. All right. Okay, bodily harm. Sharp objects. 65 is sharp objects should be kept out of reach. 66, firearms should be kept in locked boxes or cabinets. So firearms, you have to educate the parents about firearms. And toddlers, 67 is toddlers. Toddlers should not be left alone with any animal. Toddlers should not be left alone with any animal. And toddlers should be taught stranger danger. Toddler 68, toddlers should be taught stranger safety. That's stranger danger. Okay, let's break down burns. Burns, guys. Okay, burns. So to avoid burns, to prevent burns, 69, the temperature should be checked. The temperature of the bath water should be checked before you place the toddler in the water, the bath water. The temperature has to be checked. And thermostats. Okay, teach the family about thermostats on that hot water heater. It should be less than 120 degrees Fahrenheit. 120 degrees. It shouldn't be any higher than that. So I want you guys to write 121, 21, 21, 21, 20, because you may see that again, especially if you're taking the exit. I'm just saying. 71, working smoke detectors. And remember, you have to check those detectors twice a year. Working smoke detectors should be kept in the home. And pot handles should be turned toward the back of the stove because you don't want the toddler to pull on the handle, because remember, they're very independent now. So 72 is pot handles. 73, electrical outlets should be covered. And 74, toddlers should wear sunscreen when outside. Drowning. Drowning now. Let's talk about drowning. How do we prevent drowning? How do we educate the families, the parents to prevent drowning? Toddlers should never, not ever, never, ever, ever be left unattended in a bathtub. Never. That's one way to prevent drownings. Toilet lids should be kept closed because remember, they're independent, right? They're independent. Toilet lids should be kept closed, and toddlers should be closely supervised when near pools. So if they're near a pool or any body of water, they should be closely supervised. Toddlers should be taught to swim, and that is one way to avoid drowning. They need to be taught to swim. So drowning. Falls. 79. Doors and windows should be kept locked. If you keep them locked, you don't have to worry about the toddler falling out of the windows. Doors and windows. And the crib mattresses should be kept in the lowest position with the rails all the way up. So the lowest position and the rails up. 81, your safety gates, they should be at the top of the stairs. They should be at the bottom of the stairs. Safety gates. Let's talk about motor vehicle accidents. Motor vehicle injuries, motor vehicle incidents. So how do we avoid, you're going to get it, if the collision is going to happen, it's going to happen, but how do we keep the toddlers safe? We're talking about our 1-year-old to 3-year-old. How do we keep them safe? Well, infants and toddlers should remain in the rear facing car seat until the age of 2 or the height recommended. So that rear facing car seat until the age of 2, or if the manufacturer says something differently. 83, toddlers over the age of 2 or who exceed the height recommendation for rear facing car seats are moved to a forward facing car seat. So toddlers over the age of 2 years old, over the age of 2 years, or who exceed the height recommendation for rear-facing car seats are moved to a forward-facing car seat. But they're still in the back seat, guys. Safest area for infants and children is the back seat of the car. And do not place rear-facing car seats in the front seat of vehicles. Do not place those rear-facing car seats in the front because of those airbags. I want you guys to put NCLEX for car seats. All right, poisoning. Poisoning, 86. Exposure to lead paint should be avoided. So you have to check the house for lead paint, the pipes for lead paint, the plumbing for lead paint or for lead, because it can cause some neurological deficits. Lead poisoning does cause neurological deficits. 87 is safety locks. Safety locks should be placed on the cabinets, especially cabinets that contain cleaners like chemicals, bleach, laundry detergent. Now these pods, kids are eating these Tide pods, game pods, because they think it's candy. So 87 is safety locks should be on those cabinets. And most importantly, guys, the phone number for poison control. It should be the poison control center. It should be kept near the phone. So the phone number for poison control is 88. Medications should be kept in a child-proof container away from the child, because they're independent and they're going to imitate what they see. So if they see you taking the medications, they feel like they can take the medications too. So medications should be kept in child-proof containers. And a working carbon monoxide detector should be placed in the home. A working. Now, for the NCLEX, they wanted to know how often you should change, how often you should inspect, and it's biannually, so twice a year. So NCLEX wants you to know about how often you should change the batteries. And then we have suffocation. Suffocation, remember, plastic bags should be avoided. Crib mattresses should fit tightly because we don't want any suffocation to occur. Crib slates should be no further apart than 6 centimeters. That's 2.3 inches. So crib slates. And pillows should be kept out of cribs. Pillows, no pillows. And drawstrings, just like those buttons, drawstrings should be removed from jackets and other clothing. And that's to prevent suffocation. All right, guys, almost there. So that's your safety and infection. Well, mostly safety for your toddler. So make sure that you guys are listening over and over and over. So if you get those questions, you'll know, you'll be able to recall the information. All right, 96. Let's talk about expected growth, development, and physical development. So why is it important that we understand the expected growth? Why do we have to know the physical development? Because if there's an abnormality or something's not right, we have to notify the physician, right? So anterior fontanelles, 96 is anterior fontanelles close by 18 months of age. So remember, the posterior is first and then the anterior. The posterior is first and then anterior closes by 18 months of age. 97, weight. At least weight. At 30 months of age, toddlers should weigh 4 times their birth weight. So 4 times their birth weight. So if they were 8 pounds and now they're 30 months, they should be 8 times 4 is 32 pounds. So 4 times their birth weight. I know, right? It doesn't seem right, but it's the truth. And 98 is toddlers grow approximately 4 to 6 pounds per year. So toddlers, they grow 4 to 6 pounds per year. 99, height. Toddlers grow about 3 inches. So toddlers grow about 3 inches per year. Head circumference and chest circumference are equal by 1 to 2 years of age. So head circumference and chest circumference are equal. So how do I remember this stuff? Like, how do I make sure that I remember this? So you can draw like a picture of a toddler. You can do your own line here. And then you know that 3 inches per year. So a child, let's say an average child is how many inches is the average child on during birth? So let's say the average inch is 20 inches, right? So if the child grows 1 inch per, I'm sorry, 3 inches per year. So at 1 year, you'll do 1 year, and then 2 year, and then 3 year. So if you started out 20 and now here it is 3 years, how many inches have, so what, 21, 23, and then what's this one? The second year. If they grow 3 inches a year, 26. And then 3 years, what? How many inches are they? 29. So just make your own graph, because you just never know, you may get it. And the most important is number is 100. So it says that the head circumference, you see the head circumference and the chest circumference are equal by 1 to 2 years of age. So whatever the head circumference is, it's going to be the chest circumference. So that's how we also determine if there's any physical development or developmental delays or any abnormalities. So remember, the head and chest are the same. So remember that, okay? All right. Let's go to Piaget, sensory motor stage transition to pre-operational stage around 2 years of age. So we have our Piaget again. So the concept of object permanence becomes fully developed. 101 is object permanence. 102 is toddlers. They have demonstrated memories of events that relate to them. 103, domestic mimicry. So now they're playing house. 103 is mimicry. They're playing house. They're mimicking their moms, and boys are mimicking their dads. And that's huge. 104, pre-operational thought does not allow for toddlers to understand other viewpoints. Remember, they're very egocentric. They can only understand their point of view. They want what they want. Again, language increases what? We did this one. Language increases between 50 to what? 300 words. 1 year using one word sentences or hollow phrases. That's another word to say it. Remember that, hollow phrases. And it's usually what? Da. 2 years using multi-words. Like, no, I don't want. No, give me. Or no, mine. They're using those multi-words now. And 3 years, they're combining several words to create simple sentences using grammatical rules. All right. So that's your toddler. Psychosocial development, again, independence is paramount. 106, toddlers often use what? Negativism. We discussed that. 107 is rituals. So ritualism is very important. Ritualism is very important. And when it comes to moral development, guys, that's Kohlberg's. Kohlberg. Remember, you may get this. This is moral development. I want you guys to start thinking about people that you feel like have no morals. So moral development is closely associated with cognitive development. "109 is egocentric. Remember that. You're probably going to get that again. Egocentric. Toddlers are very egocentric. They want what they want. And punishment and obedience orientation begin with a sense that good behavior is rewarded and bad behavior is punished. Self-concept. Self-concept development. Toddlers progressively see themselves as separate from their parents and increase their exploration away from them. That's between the ages of 1 and 3. And body image changes. Toddlers appreciate the usefulness of various body parts now. They're starting to appreciate it. Okay, toddlers appreciate it. And toddlers develop gender identity by 3 years of age. Gender identity. All right. So let's go over these age-appropriate activities again. For age-appropriate activities, solitary play involves parallel play in which toddlers observe other children and then might engage. Okay? So we discussed this earlier. Remember, 114 is filling and emptying containers. That's appropriate. Playing with blocks is appropriate. Looking at books is appropriate. Push-pull toys are appropriate. Tossing balls are appropriate. Finger paints are appropriate. Large puzzle pieces are appropriate. Thick crayons are appropriate. And remember, temper tantrums, the terrible twos. Providing consistent age-appropriate expectations is 124. And remember your toilet training. So toilet training can begin when the toddlers have the sensation or the need to urinate or defecate. So when they tell you I have to pee-pee or I have to boo-boo, then it's time to toilet train. So sometimes they'll even say when the toddler removes the pamper, when they remove the diaper after they have urinated, or they remove the diaper after they have defecated, then it's time to toilet train. Parents should have, parents have to have a patience and consistency when toilet training. Can't lose your cool. And remember, bedwetting, because the nighttime control is the last to develop. So bedwetting may occur. So you have to make sure that you tell the parents that. 128, make sure there's well-defined boundaries. This is big for nurses because you have to establish boundaries with toddlers, guys, especially if you're working in a hospital. So between the ages of 1 and 3, well-defined boundaries. 128, toilet training, again, begins when the toddler has the need to urinate or defecate. If they tell you they have to go, it's time to toilet train. Parents should demonstrate patience and consistency. Remember, nighttime control may develop last, and discipline should be consistent. with well-defined boundaries. All right, guys. The rest is just repeat. So you can just go rewind the tape if you want to just repeat it, which this is how I learn. 132. You guys can just go over the review again. It's recorded. It's on YouTube. If you need extra practice, I put it here for you because we are done with that. All right. I just, made extra lines for you guys just in case you guys want to go over it in the middle of the night. I learned through repetition. So some of you guys learned through repetition. So I put it there for you. Okay. All right, guys. So I'll see you guys tomorrow at 2:30. We're going to finish up. And then next week, I think, what are we doing next week? Next week, I think is basic care and comfort. So just join me tomorrow at 2:30 and we'll just finish up this series. All right, guys. See you tomorrow. And I'll send you guys the printout.